Diagnoses are increasing in the United States, according to a new study published by the Centers for Disease Control and Prevention. It found 1 in 31 children were diagnosed with autism by 8 years old in 2022. The CDC's previous report found the rate was 1 diagnosis for every 36th child in 2020. In a press briefing Wednesday, Health and Human Services Secretary Robert F. Kennedy Jr. blamed environmental toxins for the increase of autism diagnoses. He also has called it an epidemic, a position some experts and advocacy groups say is misleading and stigmatizing. CBS News digital reporter Alex Tin joins us now for more. Alex, Secretary Kennedy previously said he'd have more answers on these diagnoses by September. What do you make of the timeline, and what's behind his claims that environmental toxins are to blame?
Yeah, so on the timeline, I mean, you'll recall that he was at the White House. He said pretty clearly that he thought these answers would be firmly uncovered by his efforts by September. But that timeline has since shifted. There was a release by the Department of Health and Human Services, that's the nation's public health agencies that he leads, saying that instead of the answers being found by September, their new timeline is that we'll begin to answer the cause of autism by September. And what you heard Secretary Kennedy say today at the press briefing, where he was asked by reporters about that timeline, he didn't commit to having answers by September. All he said was that in the next few weeks, they plan to announce details of how they're going to study the so-called causes of autism that he is looking into. Now, on the topic of environmental toxins, look, it's true. Researchers have been looking for a long time at the possibility that there are a number of factors that could impact autism, as well as a number of other intellectual disabilities. Lead poisoning is the big one that a lot of people have probably heard about at home. But of course, that is separate from the research specifically into autism, which many scientists funded both by the U.S. federal government and overseas have found are largely attributable to genetic factors. Now, obviously, there could be a complex interplay between those two. That's the subject of a lot of research going on right now. And a lot of those researchers say they're skeptical any, significant answers will be unearthed in the next few months.
Let's go ahead and shift gears. One of the senior scientists for the CDC's measles response says the agency believes there are a large number of measles cases that are either not being reported or being underreported. How does this affect the nation's response?
Yeah, that's right. So, we heard the CDC senior scientist on the measles response asked at a meeting yesterday at the CDC about this. Part of the reason that this has been such a question is because the number of deaths to the number of reported cases just isn't adding up. We know from outbreaks in history and from overseas that to have this many deaths compared to the number of reported cases in the United States, just around 700, would be unheard of. I mean, that would be a mortality rate higher than a lot of far more deadly diseases. So what you heard from that scientist is say, yes, we do believe, based on that case fatality ratio, that there are many deaths going unreported. And we know that the CDC has said, talking with families, talking with the local health officials, that many have also said that, yes, they know of people who likely had measles symptoms but never got tested, never got reported. And of course, that is leading to the concern that a lot of health officials, both at the federal, state, and local levels have said, which is, with all these missed cases, you're getting misspread, and that makes it much harder to contain this virus.
Okay. Alex Tin, thank you for your reporting.